All right, so I am Carly Prohaska. I am the Dementia Care Specialist here at the Aging and Disability Resource Center. So this presentation is basically just going to go through all the departments here at the ADRC, talking about what programs there are and how they benefit you as caregivers. Each kind of department is going to talk for about 15 minutes. And if you have questions throughout, feel free to put your questions in the chat box. And then you can ask questions throughout the presentation. Depending on your device, at the top right corner will be your video if you want to turn that on or off, as well as a little microphone so you can mute yourself so everybody can hear. There's no echoes or anything like that. And then, like I said, if any questions, feel free to put those in the chat box and then unmute yourself. So the first part we're going to go to is Maureen Miller to talk about the Resource Center staff and how they can benefit you as a caregiver. So I will turn it over to Maureen.
Thank you, Carly. As Carly said, I'm Maureen Miller. I'm the Assistant Director at the Aging and Disability Resource Center, and I will be sharing information with you today about the Resource Center section of the Aging and Disability Resource Center. So I'm briefly going to touch on 6 different programs and areas within the agency. Feel free, like Carly said, to ask any questions you have. You can ask, put them in chat. You can unmute yourself and ask a question. Feel free. I'll just take them as they come, or you can wait till my presentation is done and I'll answer them at the end. Either way is fine with me. So just to let you know where the Resource Center division is located within Lincoln Center, if you are at the reception desk and you're facing the south end of the building, so directly opposite of where you are at the reception desk, they are just past the elevator on the southwest quarter of the building. So they're kind of behind a door, tucked away a little bit, but all of the Resource Center staff is located there. When you enter that hallway, you will find the Elder Benefit Specialists. We call them EBS. Maria and Lindsay are our 2 professionals in that area, and they will work with you on different things such as private health and disability insurance issues, prescription drug assistance programs, supplemental nutrition assistance programs or food share, Medicare A, B, C, and D, as we like to call it, alphabet soup, Social Security, or Medicaid. They can basically provide unbiased, accurate information on public and private benefits and programs. They can provide assistance in determining benefits or programs to which you may be entitled. They can discuss your choices and the programs or services that may best meet your needs. And they can also provide assistance and representation when it's needed in obtaining or retaining benefits or services. So when you want to know more about public or private benefit programs, Maria and Lindsay are the 2 gals that you would stop to talk to at the Lincoln Center. They can also help you again with applying for benefits, or if you have a denial for a benefit program that you believe you're entitled to, they can help with that as well. So they're really good. Right now, they're working solely on Medicare Part D and C enrollments because it's an annual open enrollment period for Medicare, but they can help with a lot of other issues as well. They can also help with folks who are just turning 65, or if you're looking at other Medicare type benefits, they can help with that. Moving on, we also have disability benefit specialists. Maxine and Tracy are the 2 specialists that work in disability services. They're basically doing similar work to the elder benefit specialists, but they're working with the folks who are ages 18 to 59. So a little bit younger group, and they're mostly working with Social Security disability and helping folks get access to those benefits that they certainly need. So I'm not going to go into a lot about disability benefit specialists, but they are here in the building if you need them. We also have information and assistance specialists, and we have Daryl, Juliana, Lai, and Paul. So we have 4 information and assistance specialists, and they are really the front door to publicly funded long-term care benefits for Portage County. We have 2 publicly funded benefit programs. We have Family Care and Iris. I'm not going to go into a lot of detail about those programs because I really don't want to pull you into the weeds on this. I just want to let you know that there are programs out there and available if you are needing assistance with your activities of daily living. And there's also income requirements for those programs as well. They also can help when you're looking at other options for housing, such as assisted living or residential care apartment complexes. Or if you're looking for in-home services to support yourself or a family member. They also can help with health concerns, home modifications, housing options, personal care, transportation, and referral to other programs. So they're available to provide individual confidential consultation to folks who are in need of any type of service. They provide options counseling, so they will do a sit down with you and talk to you about what options are available in the community or within our agency to meet the needs that you have for you and your loved one. They can also offer up-to-date information, again, like I said, on local housing, in-home services, service providers, and approximate costs for those services. A lot of times, things are more costly than we assume they are. So it's nice to know a little bit up front how much things might cost. They can also, like I said, they are the front door to publicly funded long-term care. So they can also offer that assessment to determine if you're functionally eligible for those programs. They're here Monday through Friday, 8 a.m. to 4:30 p.m., but they can also work with you outside of those hours if that's not convenient for you. Feel free to contact them here if there's any service that you're looking for, or if you just have a question that you're not sure who to go to, information and assistance specialists are the ones who could answer for you, okay? The next thing I'd like to talk about is our loan closet. So Hope Bamowski, who's one of our receptionists, is also the person who runs our loan closet. Our loan closet is open 1 to 3 Monday through Friday or by appointment. It's located in the basement of the Lincoln Center, and they have a lot of durable medical equipment that is available for loan. So we have wheelchairs and transport chairs, walkers, canes, knee scooters, things of that nature. There's also a lot of low vision aids that are available in the loan closet. We have some blood pressure cuffs and some medication pill planners. There's actually some talking pill planners down there that if you need a reminder type system that can give you an alarm or such. Some of them are locking, so they can be a lock device so that your loved one can't access the pills on their own. They look like a little flying saucer. They're pretty compact, but we do have a few of those available too if you're looking for something of that nature. Most of the items we have in the loan closet can be loaned for however long someone needs them. They're really meant to be a trial. So if you're I'm just not sure what I need, but I want to try something. Stop in at the loan closet, and Hope would be happy to help navigate through what we might have, brainstorm some ideas for you of what might be helpful for your loved one. You can borrow something, like I said, for a couple weeks. Or, just keep trying. Sometimes you just need to try lots of different options. The one thing that we also have that may be of help, Lore, who is one of our information and assistance specialists, has some toolkits. They're actually really large suitcases in her office. There's assistive technology is in there. There's lots of different gadgets and gizmos that can be looked at. She can't give them to you to borrow, but she can help you locate them if it's something you're interested in, just to help people who are looking for just different ideas. I mean, some things as simple as pipe insulation that you need a bigger utensil. Maybe you have Parkinson's or something else that you're dealing with as a caregiver for your loved one, and they can't quite grasp a spoon or a fork, and they need a bigger handle. Sometimes something as simple as some pipe insulation, the gray foam that you can just stick on the end to make that a bigger handle works, but there's also weighted utensils that you could try, or large handled utensils. Lots of different ideas out there. And like I said, we have 2 very large suitcases full of technology that we'd be happy to show you at any point if there's things that you're looking for or interested in finding, and Lai would be the person for that. We also have a program called Project Lifesaver. And Project Lifesaver is designed for people who wander and who wander repeatedly. It's not for someone who wanders away one time, but perhaps you have a care recipient who is wandering frequently. And you're really concerned about that person being lost, that, they just walk out that door and they're not telling anyone that they're leaving. It's working directly with law enforcement to ensure that the person can be found quickly. There's a device that they wear on their wrist. It's got a little transmitter in it that can be transmits radio waves and can be found. They can be located even if they got inside a brick building, they'd be able to locate them. There's a cost for that program. Again, I'm just giving you a very high overview of these programs, but questions for Project Lifesaver can be directed to Paul Alavin, who's one of our information and assistance specialists. Excuse me. Last program that I want to talk about is the chore provider program. So we have a list of vetted individuals who've had an interview with staff here at Lincoln Center, and they've also completed a background check, who have basically filled out an application and said, I am interested in providing a service to individuals in the community, and this is my charge. Most of them charge between $10 and $15 per hour, depending on what the service is. But they can provide services for in-home care, for lawn care, snow shoveling, minor home repair, respite care, running errands, pretty much anything people are looking for. We may have a chore provider who's willing to do that type of service. There is a fee. Again, like I said, most of them charge between $10 to $15 per hour, but sometimes it's a one-time job, and so we figure that out by the job. And that's all determined between you and the chore provider. Basically what happens is if you call into information and assistance and say, hey, I'm interested in someone who can maybe come in and provide some in-home care for my loved one. They're going to ask you where you're located within the county, because they want to know which end of, are you right in the middle of Stevens Point? Are you out in Kellner, or where are you located? So we can find people who are close in proximity to you. And then what the needs are. Does your loved one only want to work with a male or a female? Do they have special, other special requests that we need to know about? And then from there, we generate a list of individuals who meet your needs, provide that list to you, and then you are in charge of basically contacting them and determining if you're going to hire them for the task that you need or not. There's lots of pros and cons to using a chore provider list. A lot of times not everyone's available during the days or times that you might need them. And so that may not be the best option for everyone, but we like to put it out there because it is an option that occasionally will work out. I think that's it for my programs. And that was a really fast, broad overview of 6 different areas within the Resource Center. Does anyone have questions?
And I think too, just to add, for some of you that might be taking notes, you can also ask for an INA. If you've gone to any of our support groups, sometimes people will say, talk to an INA. That's the information and assistance specialist. That is the same thing interchangeably, so there's no confusion there. And if there is any questions that do come up, again, you can put them in the chat, and then we can talk to them or talk to the questions at the end of the session as well. But any questions for Maureen right now? Check the chat. It doesn't look like any right now, so we'll go over to Tanya Simmons, who's going to talk about caregiver support services.
Thanks, Carly. Hi, everybody. My name is Tanya Simmons, and I'm the Caregiver Services Manager here at the ADRC. And the program I'll be reviewing with you is called Caregiver Support Services. Caregiver Support Services offers assistance to caregivers by navigating through services available to them. Oftentimes, caregivers aren't even sure what is needed or know which questions to ask, much less which services are available to them until we start, I guess, dissecting through each individual situation. And then together we review a tool that we call the Caregiver Roadmap. And this roadmap helps identify your greatest needs or emergencies. We define complex terminology. So for an example, differences between care facilities, different levels of care, and it assists with identifying exactly where you are at on that roadmap and where it might lead. Additional services that are offered that fall under the caregiver services umbrella include the Adult Day Center, which is a day service program here located within our building. Mary Dulski is the supervisor of that program. And then our dementia care specialist program, and Carly is our dementia care specialist at the agency. And I know she'll have more to talk about in a few minutes. Examples of services might include training opportunities. So we do offer a class for caregivers. It's an evidence-based class called Powerful Tools for Caregivers. We offer that several times throughout the year, and it's a class that is taken once a week, and it runs for a 6-week period. The weeks kind of build off of each other. We offer support from each other. So Carly had mentioned the support group. We offer a caregiver support group consisting of people going through similar situations, even though any type of caregiver is welcome to attend the group. It just so happens that the majority of the caregivers we're working with have some sort of a dementia story to tell. And we offer 3 different support groups every month. We've been doing that since COVID started and have decided to just maintain that type of a schedule just because we're seeing new faces and the need is there. There's financial assistance available, and like Maureen had mentioned, a high overview of that. There are a lot of details that go along with that, but if you, as a caregiver, find you're in need of support in this area, we have caregiver funds to help pay for things to keep people in their homes longer safely. So examples could be safety devices, maybe some grab bars are needed, lift chairs, incontinence supplies. We can help with reimbursing for different types of respite for you as a caregiver so that you can get a break. Or also, like Maureen had mentioned, that chore provider list, we can assist with helping pay for some of that in-home help as well. And going back to the respite piece, the Adult Day Center that I mentioned does provide respite services here again within our building so that caregivers can have a break. After an initial enrollment packet is completed, which Mary does a great job trying to make that as seamless and easy as possible for you, she'll work with you then to, put together some sort of a schedule. We have a drop-in service where she just needs a 24-hour notice whether somebody's coming, or people can be on a regular schedule. We have some participants who are here once a week and others 5 days a week. So it's totally flexible based on your needs. And this service has helped working caregivers, those needing help in order to just run an errand or attend a class, or, maybe you are involved in something here at Lincoln Center and, or you want to remain social or whatever it might be. The Adult Day Center definitely could be just what you're looking for so that you can get that break that you need. Caregivers' needs, as we know, will change over time, especially since, life circumstances change. So ongoing communication helps with the care transitions. So I know Carly mentioned also about, if you call or you've heard us talk about the INA, meaning information and assistance specialist, and Maureen talking about the chore provider list. We do a great job internally when we're speaking with somebody if we know we're sort of crossing over into another area of somebody else in the building, and we're really good at making those internal referrals. However, we also don't forget about our external resources and partners. So other initiatives within caregiver support services specifically, it's important that we connect caregivers to those external resources in order to meet those ongoing needs and changes. So throughout the year, we'll offer presentations. Sometimes they're part of our support groups. Sometimes we have special events throughout the year, acknowledging like National Family Caregiver Month, which is why on the last day of the month here in November, we're offering this service. So, and several other things that are either advertised in our newsletter, the Post, or if you are on our email list, Carly sends that out regularly also. So we try to acknowledge those hot topics that caregivers are talking about. And so we'll offer these types of presentations. So some examples of those might be that caregiver roadmap itself that I mentioned. We do have a panel of experts, and I know several of you had been on that informational session that we just offered a week or two ago, similar to this. But also we sometimes have presentations from attorneys regarding long-term care planning, advanced directive paperwork, experts who can speak specifically to dementia and those disease-specific problems and advocacy efforts that go along with it. We touch on caregiver self-care. The list just really does go on and on. So we're open to suggestions regarding that too. And it's, you know, we work off of that concept that if one person asks it, we're assuming that several others are wondering the same thing. So again, when you call our main number, the reception staff is really good at listening for what you are starting to ask for. So please don't feel like you need to know exactly what to ask for. They will get you to a person. And if we realize that there's yet somebody even more efficient and effective to speak with you at that moment, we'll definitely get you to the right place. So we just want you to make that phone call here. Any questions?
Doesn't look like any in the chat as well. And also just to kind of briefly talk on the dementia care specialist program. So I'm obviously the dementia care specialist, so I help with the support groups, but I also facilitate a memory cafe. So that is monthly. And what that is essentially someone and their care partner are able to come and be in a stigma-free environment. In the past, we've done historical bus tours. We've had the canine dogs do demonstrations. We've done donations to food pantries. So it's more just getting people involved in the community and feeling like even if their care receiver has a dementia, they don't need to be just staying at home. They can still be active in the community. And just getting people around like-minded individuals, so caregivers and recipients don't feel like they're alone and that they don't have like, okay, well, I have this disease, nobody else does. Just a very inclusive environment. And to talk about too the Safe and Sound program. So Maureen had mentioned the Project Lifesaver program, and Safe and Sound is a program very similar. It's a wandering program. And we always tell families that, you know, your loved one may not wander today, but they might tomorrow. And it's a plan to have in place and never need it than to need it and then we don't have it done. That is a free program. So if that's something that was ever of interest to you, you can just call the main number and ask for me, and then we can do that enrollment. The enrollment is very quick and easy. And then we update that every 6 months just to make sure all the demographic is up to date. If there's any address changes, any health changes, etc., that dispatch would then have all of that information, because then all the information on the enrollment is sent with that. So if you were to call dispatch and say your loved one, you know, started walking down Division Street and you don't know where they're at least you're able to say they're in safe and sound, and they can pull up all of that information in their squad, so they have all of that updated information on your care recipient. So any questions kind of briefly about caregiver support services or the dementia care specialist program? I also do a lot of education with families. If you don't know what dementia looks like, what the disease may, look like down the road, talking through behavior situations. So basically anything dementia related, I'm your girl. Any questions? It looks like we might have something in the chat. Caregiver roadmap, excellent visual. Thank you, Judy. All right, and as questions come up, feel free to put those in the chat or unmute yourself. So we will move on next to Christy with nutrition. Christy, you're muted.
That's exactly why I asked if everyone could hear me okay. So thanks, Carly, for the heads up that you could not hear me. My name is Christy Cooley, and I'm the Nutrition Program Manager with the ADRC of Portage County. And I am here today to share information with you about the services and our program offered to seniors in Portage County. And I want to thank you for joining us today to learn more about the services and our offerings, and look forward to questions you may have at the end of our presentation. So I want to start with home delivered meals, also known as rural delivered meals here at the ADRC of Portage County. You might be more familiar with it called Meals on Wheels. And those are all one and the same. It just depends on which service area you might live in within our county. But what I'd like really to let you know is that we're more than just a meal. The home delivered meal program provides healthy meals delivered to the home and an informal safety check for the homebound older individual. The home delivered meal program serves as a primary access point for other home and community-based services. Volunteers and/or paid staff who deliver the meals report any health or other issues they may have observed in that meal delivery. The purpose of the Older Americans Act, and that's what we operate under, is to reduce hunger and food insecurity, to promote socialization of older individuals, and to promote the health and well-being of older individuals by assisting the individuals to gain access to nutrition and other disease prevention or health promotion services. So we are in a perfect location in order to refer into caregiver services, resource center, senior center when we're making our home delivered meals. So we're in a great place here at the ADRC to refer back into those programs when we deliver a meal. So with assisting individuals with the meal, we can gain access to other services, nutrition related, which I'll talk a little bit more about, as well as other disease prevention and health promotion services to help delay, if possible, the onset of adverse health conditions resulting from poor nutritional health or a sedentary lifestyle. So how can we do that? We do that to meet the objectives. We prevent malnutrition and promote good health through nutrition education. We do that actually on a monthly basis by providing some nutrition education with our meals. We actually do nutrition screening and intervention of our participants, and I'll talk a little bit more about that as well. We offer wholesome, delicious meals through the promotion and maintenance of a high standard of food safety and sanitation. And we promote and maintain coordination with nutrition related or other supportive services for older individuals. We have a home delivered meal application. It actually is available online on our website that you would fill that out as you if you would need those services. So I want to talk a little bit more about how we're more than a meal. And I want to start with a quote by Merrill Guzner, and he's an editor emeritus, and More Than a Meal, Life Without Home Delivered Meals. When fewer people show up in seniors' homes, where 1 in 4 live alone, it increases social isolation, a major contributor to senior health. Another set of eyes never sees the potential hazards that can lead to falls. No one identifies ahead of time the gradual deterioration in the health status that eventually leads to expensive hospitalizations. So that's how rural delivered meals or meals on wheels, home delivered meals is more than a meal. It makes the difference. We know that many elderly are on a fixed income, so our participants may pay on a donation basis if they're able to. No eligible senior is denied the ability to participate in our program based upon their ability to contribute or not. One of the other things that I would want to share, I would say that relieving and supporting caregivers results in overall improved quality of life. So I'm going to give an example. My mom and dad, my dad has been gone almost 3 years now, but prior to his passing, my mom was his caregiver. And, you know, in addition to taking care of him, it meant that she needed to take care of herself as well. And with that, having somebody come in and provide a meal for them, check on them, make sure they were okay, it allowed her to provide that care for him while still making sure that she ate a nutritionally well-balanced meal. We also know that adults who are lonely or socially isolated self-report worse physical health, have more physician visits, and have higher mortality rates. So again, we feel that by being that one person that somebody sees on a consistent basis 5 days a week, or whatever days that they choose, that we can decrease those health disparities. Home delivered participants who cannot leave their home still receive quality care, resulting for them staying in their home as long as possible. And I know as all of our services that we shared today, you know, when I talk to seniors, if I ask how many of you desire to end up in a nursing home, I don't have to fight off people raising their hands. You know, their goal is to age with dignity in their home of their choosing, and a home delivered meal can assist with that. We also help keep our participants safe and their families and friends at ease. 6 out of 10, we do a survey every year. 6 out of 10 of the individuals in our home delivered meals say that the driver is the only person that they see. So that's pretty significant. 46% of our participants say they would not have at least one hot meal if we didn't deliver a meal to them. And almost half of our participants feel that the meal maintains or improves their health or chronic condition. So I just want to kind of share a little bit more of some like statistics just to kind of give you a cost. Again, our program is a donation program. So again, as long as you're over age 60 and you're homebound, you can participate in the home delivered meal program. A cost of 1 meal per day. Comparing that to 1 day in a hospital is $2,500. 1 day in a nursing home might be $275 or more. Tanya might give some more valid numbers. So compared to a $4 donation of a meal. So a little bit more I wanted to share about the nutrition assessment and education referral with home delivered meals. So as I talked about the safety check and actually providing a nutritious meal to them, it's also a nutrition assessment. So within the first 30 days, some of my staff will actually come out traditionally into the home and do an assessment with that person, kind of looking at their activities of daily living and their IADLs. And what we do is it kind of helps us determine if there's some other services that we can ask if they wanted referrals into, whether it might be the support group, whether it might be the resource center, whether it might be an activity with the senior center. So other services that might help them as they age well in their home. It might be something to the loan closet. Maybe they could use a grab bar or a cane or a wheelchair, and we can do those referrals. And then annually we go in and reassess them again. So that's just one thing. And some of the data I shared with you earlier, again, we can see that people maintain and or improve their status over half the time staying on our home delivered meal service. And I just want you to know from the ADRC perspective, we do coordinate our services as well. So whether the ADRC, again, provides home delivered meals to everyone within Portage County, but we coordinate with the Meals on Wheels of Stevens Point office. So if you live in the city of Stevens Point, Park Ridge, or Whiting, it would be the Meals on Wheels office that provides that meal. If you live everywhere else in the county, it would be the ADRC of Portage County. That being said, we also coordinate with other counties. So sometimes somebody who's close to the border of Marathon, Wood, Wapaka, Waushara County, their agency will give us a call. And if we happen to be more in that area than them, it might work better for us to deliver that meal and vice versa. And then we also work with managed healthcare organizations. If they have a person who's on services, they might be willing to establish a frequency for home delivered meals for that individual. And then 2 other programs that the nutrition program offers is liquid supplements, also known as Ensure or Ensure Plus. So we currently offer that. So if somebody is receiving that and has a prescription from their physician, they can give us a call and we can provide that to them at a reduced, I shouldn't say reduced cost, we provide it at cost to them. So we just need a physician's note to work with that individual to give them access to Ensure or Ensure Plus. And then sometimes people change, and it allows them accesses to not just home delivered meals, but when congregate dining opens, sometimes we have individuals who, even though they're homebound most of the time, they enjoy a party, so they'll come in for special events when our congregate dining happens. So kind of looking at my time. Do I have a few more minutes, or should we go back to questions?
Yep, you're good. You're good.
So 2019 was our last traditional year of home delivered meals, and just to kind of let you know again, in that year, 76% of the persons that we did home assessments on that year compared to the other year that we had seen them, 6% maintained or improved their nutritional status from when we worked with them the first time. We make sure that we're more than a meal. I want to share a quote with you from somebody, one of our home delivered meal participants. I just really want to thank you for the wonderful meals. They have been really good, and I'm pretty incapacitated, so I'm not able to do a lot of things. So thank you again. If it wasn't, participant B, if it wasn't for your meals, I don't know what I would eat because I don't have the ability to cook. So those are some pretty heartfelt things that we hear. I'll let you know in the event of weather adversity, sometimes we need to close services. That's when my staff make personal phone calls to individuals to make sure that they're okay, and let them know that we will not be making a delivery today. So we check on them whether we're there in person that day or whether it's by phone call to make sure they're okay. In 2019, it was a very unusual year. We had 12 unprecedented building closures that year. So we had almost 2,000 phone calls that we made that year to individuals to make sure they were okay on those closure days. I'll talk a little bit more about the meals. Again, our meals meet the older Americans guidelines. So again, it provides a third of their caloric intake. It's a great source of protein, low in saturated fat, low in cholesterol, a great source of calcium, vitamin A, vitamin D, vitamin C. We have a homemade from scratch kitchen. We cook from scratch here with 1.5 amazing FTEs. We work with local vendors to provide local foods when we can. So we do some composting. We have a hydroponic growing tower. So the food that we eat is pretty amazing. And so we're able to offer that to the seniors who participate in our program. I'm just trying to think of, in the event of those closures that I talked about earlier, I guess I would say that we do also provide a shelf-stable meal kit each season, so that in the event that we are closed and we call them on that safety check, we would remind them to use one of those meals. They aren't homemade from scratch, but they are something that can sit on the shelf and be prepared on that day for that senior. And I look at them and make sure it's something that's, easy to open and still nutritionally sound, but not quite to the same level that our traditional meals would be. And so with that, I would just say that we know that seniors we serve enjoy what we do. We know that many things change as we age, and to help combat malnutrition, we know that a nutritionally sound meal is important. We know that we eat with our eyes, and so that's why we cook from scratch. So we're excited to prepare the meals for them each day and do that safety check by delivering the meal and then annually going in and reassessing. So that is what the home delivered meal program out of the ADRC of Portage County does. And I will leave it for questions.
And Christy, anybody can participate too. They can participate once a week. They can participate on special events. They don't have to do a minimum amount of days, correct?
Correct. We have individuals when they call and sign up for home delivered meals. If they make a phone call to us at 715-346-1401, we will kind of go through the screening process with them, and they can determine what days they want. But some frequency, whether it's just Tuesdays of every week, or Thursdays, or Tuesdays and Thursdays. And then all we ask is that individuals just call 24 hours in advance if they want to make a cancellation. And then if they're filling out the application online, they would do all of that same information, and then we would be in contact with them within the next 1 to 3 days after receiving an application to go through more details and establish a start date.
Perfect. And also, if you didn't see in the chat, Tanya had mentioned too that the nutrition program does provide all the meals for the participants in the Adult Day Center as well. So if you were to ever use Adult Day Center, you can bring, a cold lunch, or they do have the nutrition program here at the ADRC. So any questions for nutrition? All right, so we'll go next to Barb to talk about RSVP.
Thank you. Hi, my name is Barb Evans, and I'm the manager of the RSVP program, which is the Retired and Senior Volunteer Program. And I also oversee the Foster Grandparent Program. In Portage County, we have approximately 470 RSVP volunteers, and those are individuals age 55 and over. And a lot of what they do throughout the county is with different organizations, but you've heard a lot about the ADRC so far today, and I will mention that over 200 volunteers volunteer in some capacity with the ADRC in one of the programs. And it could be one of any number of things. It could be with the meal deliveries, it could be as class leaders, it could be with special events, preparing meals. There are a lot of volunteers that engage on a regular basis throughout the ADRC and also throughout the county. Some of the things that volunteers do are mentoring with teenagers, and particularly at the alternative high school, we have a wood shop there and have volunteers who work there with the teenagers, the high school students, and build projects together, build a relationship, and do some mentoring and just talk about their life experiences and try to help guide those individuals. And we also have a mentoring program at the Juvenile Detention Center. And if you're not familiar with that, that is children who are incarcerated, and their ages 10 up to 17. And that is a very rewarding experience for those that are mentoring those individuals there, and also for the students that are there, the children that are there. And I say children because if they're under 17, they're still children. We have volunteers who work at Operation Bootstrap, at various food pantries throughout the county, and different school programs with mentoring children and doing reading programs with them. We also have volunteers at the hospital. A lot of them aren't welcome back just yet, but we're picking up speed again, and things are hopefully getting back to a normal state as we transition through the past year and a half. We also have volunteers who volunteer at home, and that might be something that's of interest to you if you are spending the majority of your time at home. And that could either be by writing notes, it could be by making phone calls to other individuals and just checking in with them. It could be doing mailings. We have volunteers who do mailings from their home. We drop off the supplies, they work on them, and then we pick them up. And we also have people who are crafters and like to do things at home, whether it's knitting, crocheting, sewing. We have a lot of materials that are donated to us that we share with all the volunteers. And any of their creations are given back into the community to those in need and to special groups that we work with. So those are some of the things that we have. In addition, we also have one-time opportunities for volunteers. And an example of that is just recently we had a holiday card signing and signed almost 900 holiday cards that are distributed out to veteran organizations, to meal recipients with the home delivered meals that Christy was just talking about, and Meals on Wheels. And it's just nice to get a card because most people don't even send cards any longer. And volunteers spend their time doing that as well. A couple of programs that might be of interest to you, you might be thinking, gosh, I'm a caregiver right now. I'm not in a situation where I can volunteer. I just can't do it. But one-time opportunities are an option, just to get away and do something for others when you have an opportunity to have a little bit of respite. Another thing would be to take advantage of some of those home opportunities that, things that you can do at home and spend a little bit of time just distracting yourself, making a phone call, just a friendly visit phone call to somebody else, or writing a note to somebody just to brighten their day a little bit. Hopefully some of you have been the recipient of some of those things. And if not, we'd be happy to add you to our list of people to receive a phone call or to receive a gift or note or a card, you know, from somebody else, just to know people are thinking about you. One of the other programs that we operate is the AARP Tax Aid Program. And I'm very happy to say that this coming year, the tax program will be operating again at Lincoln Center. And that is a program for older adults and adults with disabilities to have free tax preparation. So that would be for federal taxes, state taxes, or homestead credits. So that's something you might be interested in taking advantage of. It's entirely operated by volunteers, and the individuals are highly trained, certified with the IRS to prepare taxes and file taxes for individuals. And as I said, that's a free service that is available to people. Another opportunity is the VIP program, which is the Vital Information Program. And RSVP operates that program as well. We have vetted volunteers or staff who help you complete a packet. And what the packet is, it's full of information that would be in case of emergency. So in there, we have not only your contact number, we have your allergies listed, your medications listed, who to contact in case of an emergency. A copy of your healthcare power of attorney we encourage that goes in there as well. And it's an easily identifiable packet that is in a very hard-cased plastic sleeve and goes on your refrigerator. So if emergency services have to respond to your home, whether you're the caregiver or care receiver, all of that information is readily available and right on your refrigerator. And we work with the communications center in Portage County and let them know who's registered and has that information. So if an ambulance is dispatched to your home, the EMTs will look for that packet and see that, okay, they're on this medication, this is their health concern, this is what's going on. And we've even gone so far as to get stickers that easily identify whether a person is a caregiver or a care receiver. And if you think about it this way, you know, if you have to call an ambulance as a caregiver, if you have to call an ambulance for yourself, you want them to know that you are caring for somebody who relies upon you. And if that individual is in their bedroom sleeping or is in another room, they won't look for another person. You know, they'll be taking care of you because that's their primary focus. But to have that packet marked that you're a caregiver or the person you're caring for is a care recipient is really important. And that way they would know who to contact to take care of the care recipient if they had to transport you. So that is a free program. I highly encourage you to give us a call and check into that. You know, I'd be happy to help you fill it out or set you up with a volunteer to get it filled out, or Carly's able to fill those out. And the biggest part is that we share that information with the communication center, who can then let the ambulance drivers know this person is registered with VIP. You know, please make sure you get that packet. You know, one of the things that one of the EMTs told us is, he said, we're not going to go hunting around for people's medications. You know, they're not going to look in your bedroom and next to your favorite chair in the living room or anything for that. So it's really important to have that on hand. And we do check with people at least once a year to update all that information. We do not keep that personal information, just so you know, we do not keep it. All we keep is your name and your phone number and your address. So we can contact you annually just to make sure you've updated your packet and to assist you if you need assistance with doing that. So those are the two programs that would probably be of most use to any of you on the call today. The other program I mentioned briefly was the foster grandparent program, and that is a volunteer program also for individuals 55 and over to work in the schools or Head Start programs. So there are income limits with that program. The volunteers are asked to serve at least 7.5 hours a week, and it's working one-on-one or in small groups in the schools and Head Start. Volunteers do receive a stipend, and it's a whopping $3 an hour that they get. It is not taxable income, and also receive mileage reimbursement. So it doesn't cost anybody to serve in the program. And then also in the schools and Head Start, they do provide lunch for everybody who's working there. So that is something else that if somebody really loves to work with children and at some point, is interested in that program, we have a coordinator who would be happy to explain that to you, and I would as well. So I noticed, Tanya, in the chat, you put down that you liked, I just saw something about pets. That's all I saw on that. Oh, like the idea of being able to place instruction for a pet left behind in the VIP packet. Yes, that is really important because you can also identify that you have a pet, and they will look for your pet. And we ask in the documents that we give you or help you fill out, it says who will take care of your pet for you. And that person is contacted, so you will not be leaving a pet behind if you have to be transported for further medical evaluation. So I think we have all those bases covered, with that. And we always ask you for at least 2 emergency contacts, so we can hopefully get a hold of somebody to let them know that you've had EMT services. So that's kind of it in a nutshell with the volunteer programs. Are there any questions?
A question for you, Barb. If somebody was looking to find those like one-time abilities to volunteer, where would they find those?
Sometimes they can find them in the post, depending on what it is. But we do have a volunteer newsletter, and would be happy to. We email it and we also mail it out. So if people are interested, we'd be happy to add them to our mailing list. Great question. Thank you, Carly.
Any other questions for Barb for RSVP? All right, so next we'll turn over to Kate, who is the Senior Center.
Hi, everybody. You can hear me all right? Okay, great. My name is Kate Giblin. I'm the Senior Center Manager here at Lincoln Center at the ADRC. When Carly approached me about this presentation, I thought it was actually pretty exciting because in the last year, as we've kind of been enduring this pandemic, we've actually had an uptick of people, a small uptick of people coming here with their care recipients. And so I wanted to talk a little bit today about what the Senior Center has to offer and how, if you are a caregiver, you can utilize that service. One of the things that I've been a caregiver of a parent, a grandparent, a foster child, my own children, and the last thing on my list is doing stuff for me. And so I wanted to really highlight that can be hard. And I completely have been immersed in caregiving to the point where I didn't let myself do anything but maybe go to the grocery store, and that was my mental health break. So I wanted to kind of talk about what we have here. For those of you who haven't been to the Lincoln Center, we have a lot of different kinds of programming. So if you want to explore your creative side, we have painting, we have wood carving, we have ceramics, pottery, we have an open art. You can work on your own project. We have exercise classes of all levels, from chair classes all the way up. And we have people who come together with their mother or their spouse to participate in those classes when they're able to do that. We have had people come together with their care recipient to take laughter yoga and other programming like that. We also offer a lot of opportunities for creative and educational opportunities. So we have Polish classes right now, and we have a fiction writing class for people who may be wanting to explore their creative side. We also have a lot of other healthcare type or health-based activities. So one of the other programs that caregivers utilize here is we have a foot care clinic. And so for taking care of, those pesky and hard to reach and sometimes really difficult feet, that can be a challenge for a caregiver. And so we do have that option here. People can schedule those appointments. And we also have some blood pressure screening, and we often try to also schedule other clinics like hepatitis C screenings and things like that. There's something new every couple months, so we really encourage you to look at the post to see what activities are going on right now. Just to give you a sneak peek, coming up in the next, after Christmas, we have scheduled the UW-Madison Geology Museum is coming. They're going to be giving a virtual tour of Devil's Lake State Park. And so you can bring yourself and just learn a little bit, or bring yourself and your care recipient and enjoy that summer walk through Devil's Lake State Park I think it's going to be in February. We also have a senior Smart Ride program coming up in the new year, and that is a really cool program for seniors to help them learn how to ride the city bus and how to use public transportation, especially how to use, paratransit if you need to be able to get someone around and may not be able to do so yourself in a car, because sometimes care recipients may need an extra help getting to appointments and things like that. So it's a really good opportunity to learn about what's out there and to stay, engaged and able to access transportation. So that's just we have a lot of these programs that are going to be coming up in the next year. We're also planning a program on how to hunt if you have disabilities, and other accessible activities that are around the state and outdoors. And so lots of opportunities to learn about ways to enrich both your life and the lives of the people that you care for. So all of that information you're going to find in the ADRC post as it comes out, or you can call me for a sneak peek. In addition to those programs, we also offer evidence-based programming, which is clinically proven programming that is health-based. And I don't know, Carly, did you touch on Powerful Tools yet?
Yeah, Tanya
Okay.
talked about it.
Okay. In addition to programs like Powerful Tools, we offer, for caregivers especially, what we see is that the health of a caregiver can be impacted negatively by the stress of being a caregiver. And so we're seeing caregivers with more long-term chronic conditions. So we also have programs for people who have pre-diabetes or diabetes. And we have programs for people who are working with chronic pain. And we have fall prevention programs, in addition to some exercise-based programs. We have a strength training program. For many of our programs, you need to be cognitively intact, and so they're very primarily for caregivers. And I encourage you to remind yourself repeatedly, and maybe write it down and put it on your refrigerator, that it's really important that you take time for yourself. And so we have a lot to offer, and you can do it with your care recipient, or you can take some time to yourself and do it for yourself. And referring back to what Tanya was saying about the Adult Day Center, we may be able to arrange for some respite here. If you want to come, take an exercise class, have lunch, and then take in a movie, we have all of that in one place, which is really special and not entirely something that you see everywhere in rural America. So you can make a day of it, you can get some respite, and we have all those things here. I think that was everything I needed to say. Do you guys have any questions?
I think, Kate, a lot of times that referral that Tanya and I go back is the Sip and Swipe program. Would you be able to briefly talk about that?
Yep. We have, right now we have a volunteer who can help people access technology. So if you are interested in learning about working with a new phone, a smartphone or a tablet, then you can call and we will pass your information on to our volunteer. She'll meet with you and make an appointment. So it works for both of you to sit down and do some technology work. And I also have, hopefully in the new year, we're going to have a new computer teacher here who's going to be able to do some computer fundamentals. So that's something I'm working on as well, because obviously if we've learned nothing from the last 20 months, it's that everybody needs to brush up on their technical literacy. So we do have that program. There's also some online programs if you're here that you can find in our ADRC post that will give you even more information with video tutorials that you can access on your own.
And I think another thing, talking about self-care, the chair massage option, that is something that you can find in the post too, that both you and your care recipient can take advantage of. And that's obviously all the information, but I think that's a great thing that you can just come here and kind of plan your whole day, and it'd be relaxing for everybody involved. Then you can use your nutrition. So that is kind of a perfect puzzle piece to show that you can use senior center stuff. You can go to, a support group and get respite. Then you can use nutrition. So that's kind of the picture perfect reason why we did this presentation. And so you guys can kind of see how all the pieces fit together instead of, just kind of talking to one person. And then when, somebody says, well, talk to Kate, and you don't know who Kate is, it's nice to have that kind of warm handoff instead of, feeling like you're being bounced around program to program and not understanding how it all fits together. So any questions now that we're kind of at the end for anybody that you've heard speak? It's a lot of information, but we wanted you guys to kind of see the benefits of this building and not just one specific department. A lot of times people will say, well, how can, this department benefit me? So that's kind of the purpose of this presentation, is so you can learn a little bit more that maybe will bring questions up. And you can also message me any questions after as well. Or does anybody from other departments have anything that maybe you thought you forgot or you want to mention?
Carly, I hope that we can get back to offering virtual dementia tours. That helps open the eyes of caregivers a lot. Would you mind explaining what that is?
Yeah, of course. So the virtual dementia tour is open to anybody. So it can be professionals, it can be public, it can be anybody who wants to attend. A lot of times caregivers that we work with will bring family so they can understand, maybe they don't understand what dementia is like. So what it is, it's a sensory simulation. And we can't go into a lot of details of like what all goes on, but what it does is you have 8 minutes to kind of experience what dementia might be like. No one can tell you 100% what it will be like, but it gives caregivers, professionals, community members just an idea to kind of relate, to understand, well, this is why my loved one is doing this behavior that we think is very, obnoxious or annoying to us. And then all of a sudden people have this light bulb moment and they're like, oh my gosh, this is why it's happening. And then after you're done with the simulation, we do a debrief with usually Tanya or I, and we're able to kind of answer those questions and say, well, in the simulation, this is what came up. Why? There's that big question of, well, why do they do this? Why did you make me do this? And being able to kind of have that emotional support afterwards. But many times, I think probably 99% of people that go through that afterwards say that it helps them become a better caregiver. It helps them become a better professional, just because it gains knowledge that you can't read in a book. You can't listen to a presentation and gain that knowledge. It's more of an experience that you feel that then has that emotional tie to whoever you're taking care of. So hopefully that kind of explained that in a quick nutshell. Any other questions or comments? And I do see that Cindy, our director, is on. Cindy, do you want to say anything?
I think you have all covered our services quite well.
Perfect. Well, if there isn't any other questions, this is recorded. So once our IT converts this for me, I will send this to you guys so you guys can have that as reference. If any questions come up, just send me an email and I will get you in contact with the person that can answer that question best for you. And as always, just reach out. Any questions you have, any services that you maybe think, oh, that could benefit, just give it a shot. If it doesn't work, it doesn't work, but at least try it. But if that's everything, thank you guys for taking time out of your day, and hopefully we will see you guys soon. Bye.
Thanks, everybody.